In the first act, I mentioned that we wouldn't be talking about too many disorders specifically. One exception, though, is ADHD, or Attention Deficit Hyperactivity Disorder. I do want to make sure and highlight this one in particular because it has been the topic of a lot of conversation, which leads us to questions about what causes the disorder, what it's related to. We define it as something that includes extreme inattention, hyperactivity, and impulsivity. And so there's some questions about, like I said, the causes and thinking about it from that biological, that psychological, and the social perspectives. You'll see this very specifically and explicitly mentioned in Charlie Bartlett and the Thumbsucker, giving you an opportunity to go back to that idea of comparing popular portrayals with our scientific knowledge. At the same time, I also want to make sure we talk a little bit about how we would treat in the psychological therapies because they seem to be depicted a lot. We'll focus in part on psychological therapies. In other words, interactions between a trained therapist and someone seeking to overcome difficulties or achieve growth. I do want to highlight this again, thinking about that potential difference between the scientific ideas or our discipline's ideas and the popular portrayals. In Down to the Bone and Charlie Bartlett, we see very explicit depictions again, but very different, highlighting the fact that, for one, there are all these different models for therapy. So, from psychoanalysis and humanistic and behavioral and cognitive to group and family, there are different models we can use to overcome those difficulties, to achieve growth. As you think about the movies and think about the material, I do want you to think about each of these modes of therapy and how they would be carried out by a professional. Psychological therapies are sometimes used alone, but another option or another alternative is what we call drug therapies. And psychopharmacology intersects here. It's a study of a drug's effects on the mind and behavior. When we talk about therapeutic uses of drugs, we can put the medications into four different categories: antipsychotics, anti anxiety, antidepressants, and mood stabilizing. Thumbsucker, The Savages, and Charlie Bartlett make reference to the different types of drug therapies. One question you might ask yourself, though, is whether they give the sense that these different drugs are used for different disorders. In other words, if we think back to what we talked about with neural communication, do they give an idea that different drugs will work with different neurotransmitters, therefore having a different impact? And with that train of thought, thinking about the drugs' interactions with the neurotransmitters, you can kind of see a natural link between drug therapies and what we could refer to as the illicit drugs that are referred to in the material on drugs and consciousness. So here we're talking about psychoactive drugs, chemical substances that alter perception and moods. We tend to think about them as being in three categories or three groups: depressants, stimulants, and hallucinogens. In Thumbsucker and Down to the Bone, the characters are portrayed using these more illicit types of drugs. And one question you might think about, though, is okay, the director, the movie depicts them as using this type of drug, but given what we know, does the behavior fit? Given our scientific knowledge, is this portrayal accurate? By thinking about the drugs in these categories, then you can think about how it sort of can unfold that they would affect behavior, how they would affect a person's day to day life. At the same time, we can think about concepts of tolerance and addiction and whether that aspect of drug use is even portrayed or how accurately it's portrayed. So that's the last set of concepts we'll build in as we think about these movies. Of course, there are multitudes of others that will apply. These just help us focus. Enjoy the movies.